The number of probable swine flu cases in New Jersey is growing. This afternoon, the state's health commissioner announced that the state has identified 2 more probable cases. Yesterday, there were 5. The World Health Organization said the outbreak that's now turned deadly in the United States is moving closer to becoming a full-scale pandemic. Health and medical correspondent Sarah Lee Kessler is here now with the latest. Sarah Lee?
Adrian, the reason that these New Jersey cases are still being called probable is because the state health department is still awaiting official confirmation from the CDC. That's the way it works. The state won't say at this point whether these probable cases, where they're located, just that they're from various regions of New Jersey. At a news conference this afternoon, state health officials announced that all of the probable cases here have been mild. No one has been hospitalized.
The Department of Health and Senior Services has been doing everything possible as this situation unfolds.
At a news conference this afternoon, Health Commissioner Heather Howard and the department's top doctors said they're in touch with the Centers for Disease Control on a daily basis as the swine flu epidemic unfolds. The CDC has assembled a staff of 250 to monitor the epidemic. So far, it's confirmed 91 H1N1 cases in 10 states, including a case in Texas that killed a toddler visiting from Mexico, the only U.S. death so far.
While we still don't know what this virus will do, we expect to see more cases, more hospitalizations, and unfortunately, we're likely to see additional deaths from the outbreak.
Ground zero in the outbreak is Mexico, where 159 people have died. But cases have now been confirmed in 9 nations. The World Health Organization has now raised its swine flu alert level to phase 5, one step short of calling it a pandemic. Dr. Paul Offit, an infectious disease expert at Children's Hospital of Philadelphia, says the public shouldn't panic.
Well, I don't think we've ever had a pandemic in the last century and a half that's killed less than 1 million people. I mean, we're not even close to that. So I think that it's important to pay attention, but I do think that we have to be careful about using the word pandemic.
The situation has been and will continue to be fluid. We expect information to change frequently as the situation evolves.
Health officials here say New Jersey is well prepared.
Today, just this morning, we received 300,000 courses of Tamiflu and other antivirals from the Strategic National Stockpile. These courses are in addition to the 800,000 courses that New Jersey purchased over the last 3 years.
Meanwhile, New Jersey health officials are urging the public to take preventive steps.
You need to wash your hands thoroughly and frequently. You need to cover your cough and sneezes. If you are sick, please stay home from work, stay home from school.
Today, New Jersey set up a 24-hour toll-free hotline for questions about swine flu. The number is 1-866-321-9571. That number again is 1-866-321-9571. Tomorrow, health officials expect to know more about the status of the first 5 probable cases here in New Jersey. Adrian?
Thanks for that update, Sarah Lee.